Okay, so I recently had a bad experience at a hospital here in Las Vegas where I was having severe stomach pain. I had surgery about 4 months ago, and it got infected, and they can't figure out what the problem is. I've gone three or four times. They bring me in. I don't get admitted. They just give me IV, pain medication, and send me on my way. Just to have me, go see your primary care. They can't figure it out. They've done CT scans. They did find a fluid-filled bubble, which I got antibiotics for, but I've been going through this pain since May. Since starting working with Dr. Elmer, I did just last week, I went to the hospital and I didn't even see a doctor. It was just the RN coming in to see me. And they sent me on my way with pain medication, which was horrible. They gave me so much pain medication, 20 milligrams of morphine and Zofran, which was, I was just so out of it. And they just laid me on the bed. I didn't have nothing to eat or drink for about 6 hours. And I was miserable. So they released me. I came to work the next day and started working with Dr. Elmer, and he is a miracle worker. He kind of like massaged me and had me do different exercises here because I've had the pain here on my right side. And just pulling and, pushing and just, I think he put some oil on me, I don't remember, and then put the stuff in my nose, and then he put this big patch on me, and that's the first time I've felt relief in the 4 months. So, what he did for me, as simple as just doing that, has helped me more than doctors.
Was the patch the tape? The
yes,
tape?
that rock tape or whatever it's called. Yes, and I've got a big patch here. And before I couldn't even, I had the pain so bad I would always be holding myself with an ice pack. I think you were here when, I don't remember, but I've always got to have an ice pack, and I have to wear like a girdle thing, and I have nothing on, and I am pain-free. I can bend down.
How many times have you seen Dr. Elmer?
One time. Very first time he treated him.
Very
first time.
That's...
And I tell him all the time he's a miracle worker. He really is.
Mm-hmm.
Because like I said, I've gone to 3 different hospitals here. They put the saline solution in me, give me pain medication, and just tell me, oh, we've got to go, they give me a CT scan or whatever, and then they just send me on my way. And nothing. And I've been feeling this pain for 4 months, and sometimes I can't even stand up. I can't sleep. I come in crying, or I don't come in at all because I'm in so much pain. And he did this Tuesday. Here it is 2 days later, and I feel like a new person.
That is awesome.
Yeah, he is amazing.
What about, so now you have an infection because you had a surgery done, right?
Yes, I did. I had
What
surgery.
about the doctor that isn't the doctor that did your surgery taking care of your infection or helping you?
She was. To me, I know, because it's not a tummy tuck. It was like I can't remember the word for it, but I had a hernia repair, and then they did the tummy tuck as well. So I had 32 stitches from here to here, and yeah, it was horrible, very painful. But about 6 weeks later, it got infected. It was horrible. The pictures are awful. I have this big gap right here where and fluid was coming out of it. And I'm thinking, this is not right. I just got out of bed, and it's just like, I'm like, what is this? So she tells me to go to the ER. I go to the ER, and they won't touch me. They just said I need to go back to see my surgeon. They were going to admit me, and she called and says, don't admit her, just have her come and see me. So I had to pack it. I could pack it with my fingers like this with the gauze, and yeah. And I was in so much pain, and she had me on Lortab 10 milligrams, ibuprofen 800, and then she tried me on 8 different antibiotics until she got the combination of 2 that finally helped it, which I did, and I just got the staples out Tuesday, and that's when I went to the hospital. But she says, well, I don't know what's going on. Well, if you don't know, I don't know. You're the doctor.
Right.
So.
What is Dr. Elmer doing about the infection?
That's gone already. That's been gone. Yeah, it's gone. It just, when I got the staples out, I was still kind of, a little bit sore. So he's just been, he gave me some oil to put on it, and he's just been, like I said, just, it's this side. So, the things he does, it's hard to explain, but he's amazing at what he does. That's all I can say. He really is.
Good. So with oils and a patch, your pain is going away.
My pain. Simple. So my pain, I would say, honestly, was about a 15. It was so bad. I was throwing up. The pain was so bad. Even here, I'm just throwing up. And when I came back from the hospital the next day to work, he asked to see the paper, and it just said abdominal pain, unknown origin. And he's like, what is that? I'm like,
And the
know.
origin, you had the surgery. Hello, you know the origin.
yes.
What is happening with our medical
Yeah.
community?
They took blood, and then when they took blood, it was an RN that did it. It was, like I said, I never saw a doctor. It was an RN that was coming in, and they took blood and just first it hurt because I was dehydrated, but blood was squirting everywhere. I'm like, oh my goodness, it was just, it was an experience and I've gone to the hospital before and they've been good, but I don't know. So this is probably like the 5th time I've gone since I've had my surgery, and they cannot figure anything. All she does is give me, here, take this pill, take this pill. I don't want to take pills. Especially they just make me sick to my stomach. I'll take, if I'm really, really in pain, I'll take half of the Lortab, but then I don't like the feeling because I'm loopy and I'm sleepy and I can't, do anything. But just one time with Dr. Elmer, he just had me, he had me lay down, and just the things, and it was just simple things that, I had to hold on to him, and he was like pushing against my leg, and I kind of, was just simple things like that. And here I am.
But it makes sense once you start, once you learn.
Yes, that's and I always tell him, you are so amazing. You're amazing. And just one time it took him, and the doctors can't figure out what's going on.
This is awesome. Okay, well, we're going to do a follow-up and see how you're doing.
Yes, for sure. Yes, for sure.
All right.
Yes.
Wonderful.
All right.
Thank you for sharing.
You're welcome.